Welcome, everyone. We'll get started in just a moment. Great. Why don't we jump right in? Thank you, everyone, for joining us today to talk about year-end compliance, an HR and benefits game plan. So I am Tasha Wilder. I'm an HR consultant here at Innovo. Let me get my slide. There we go. There we are. I'm an HR consultant here at Innovo, and presenting with me today is Scott Croswell. He is a senior benefits consultant here at Innovo on the account management side of the business. Before we jump in, I'll get a little introduction to Innovo Benefits Group. So we are an independently owned boutique employee benefits brokerage. We're out of Concord, Massachusetts. We work with our clients to create and manage competitive benefits package that help you attract and retain your top talent. We also have fractional HR services, HR consulting, benefits administration, as well as in-house COBRA. This is a new picture that we have. So this was back in August at our quarterly meeting in our new office space, also in Concord, Mass. Our team is growing and it is wonderful to see. We're also going to be sending out this presentation. So these are all links where you can check us out, check out our reviews, follow us on LinkedIn, and stay in touch. A little housekeeping before we jump in. So there's going to be a few polls throughout the presentation. Also, if you have any questions, you can send those right to the Q&A and we can get to those at the end. And as I said, we're going to be sending this presentation out that will have links to some pieces in the presentation. This is our agenda. So this is just a high level overview of what we're going to be going over. So today we're just going to provide a general overview. Some of these bullets here could be full day sessions, but this just a reminder as we approach year end of some of the pieces to think about and to take a look at. We know that some folks are on different schedules other than the calendar year. So these are just some reminders. And if you have additional questions or need details on a specific topic, please feel free to reach out to any of us here at Innovo. Great, we have our first poll question. How many employees are in your organization? The results are popping up. All right, we have a range anywhere from that 5 to 25 to the 100 plus. So some of the things that we are going to be going over today, there's certain thresholds for that compliance piece. You may need to complete it, you may not, based on your population size, but we have a little something for everyone. Go to the next slide here. There you go. I'm gonna throw it over to Scott.
Awesome. Thanks, Tasha. Good afternoon, everyone. On year-end reminders, we're going to touch on imputed income. First, the life insurance component. If you're providing more than $50,000 in employer-paid life insurance, you have to impute income to your employees, and you see the rates that are provided by the government, you use the rates, that are provided by the government to determine the value. You see the link here. This is where you find the rates to determine the value. These rates have been the same for years. Most employers, again, do this at the end of the year, right? So also, if you're covering domestic partners under your medical plan, for example, you have to impute the income that the employer is paying towards the domestic partner. That is taxable income to the employee, and the employee cannot pay with pre-tax dollars for their share that is applicable to the domestic partner. Now, when Innovo brings on new clients, often we will see this component of the imputed income being missed, that domestic partner imputed income. For employers with group disability plans, if you're grossing them up or offering tax choice where employees receive a tax-free benefit if they agree to be taxed on the premium that the employer is paying on their behalf for the disability benefit, you would be taxing employees based on the rates that you pay to the carrier. Again, most employers tackle the imputed income responsibilities at the end of the year. Quick example on how the domestic partner taxation works. In this instance, the total premium for single coverage is $619 or so, with the employer paying 71% of the premiums. So call it $440, while the employee pays $180 or so with pre-tax dollars. For employee plus dependent domestic partner coverage, excuse me, the employer is still paying 71% of the premiums for this tier of coverage. The employee is paying the same $180 or so with pre-tax dollars for themselves. And the post-tax contribution is $291, which is taking that $1,623 total premium number and subtracting the employer contribution to the coverage and subtracting the employee's portion of the coverage. To calculate the imputed income, you take the employer contribution dollar amount that it's paying towards the employee plus domestic partner coverage and subtracting the employer contribution towards the single coverage from it, which in this example leaves $713 in imputed income, which of course is taxable. For Innovo's current clients, feel free to reach out to any one of your Innovo account managers to assist with this. Tasha, you can move on to the next slide. So this is an LTD gross up tax choice example. So I'll quickly run through this. This right here, it's showing obviously LTD in the middle here without gross up, so taxable benefit, versus LTD with gross up, a non-taxable benefit. In this example, the employee is making $100,000. The annual employer paid premium in this example without gross up, the taxable benefit is $250. With the non-taxable benefit, it's $310. Now, typically, when you elect or when you choose a gross up or a tax choice option with the carrier, the premium is going to be higher because employees receive a richer benefit. So that's why in this example, we're showing the premium being a little bit higher on the non-taxable benefit. The annual tax on the premium, assuming 30%, again, with a taxable benefit, there's no tax that the employee is responsible for. On the non-taxable benefit, the gross up option, I'm showing the annual taxes being $93. So employees paying a small dollar amount, right? Short dollars to get a much richer benefit should they go out on disability. So again, the gross annual disability benefit is still the same if when you're disabled, $60,000 in this example, right? So 60% of that $100,000. Tax on the benefit is $18,000 when it's taxed. And then obviously with the non-taxable benefit, it's zero. So you see that net annual LTD benefit being much richer for such small dollars of the employee paying tax on the premium that the employer pays on behalf of them. So, we make the argument that long-term disability is the number 2 most important benefit behind medical, because it can provide you a monthly income stream all the way up to your normal retirement age. So potentially decades of a benefit. And you can see how by having a non-taxable benefit, how much more money you would get over that length of time. Flexible spending and dependent care and health saving accounts, reminders, these are increasing for 2026. The FSA should be coming out any day or any week now. The dependent care, excuse me, this is the first increase in 40 years, 2026. So that's exciting, bumping up from 5,000 to 7,500. Hopefully it's not another 40,000, another 40 years before we get another increase. But, so, and the HSA limits are also increasing for 2026. So just make sure you update your documentation and work with your TPAs on getting these IRS maximums implemented for 2026. Salary updates, so for employers that are offering group life and disability plans, a component of the pricing for these plans is based on salaries. So make sure you update everyone's salaries with the carrier. Some plans are set up where you make this change for on every January 1st. Others have you update the salaries on your plan's anniversary date or at the time, at the date of a salary change. So just check with the carrier on when the salary update should be made, but it should be made at least once a year. Also, don't forget that employee paid or voluntary life and other similar plans as rates are based on employees' ages. Rates don't typically change each year. Rates are usually age bracketed every 5 years. So age banded rates every 5 years, they would change after 5 years. So it's a good idea to check if someone is moving into a different age bracket where the rates will be different.
Great, thanks, Scott. So I'm going to talk a little bit about some of the paid family state leaves. First up, Massachusetts. We're a Massachusetts-based employer. I know we have a lot of folks out there that have Massachusetts, a lot of Massachusetts employees. So reminder for Mass PFML to update or take a look at those payroll deductions. So for the third consecutive year, so for 2026, there's not going to be a rate change to the employee-employer contribution rate. Those are going to stay the same. However, there are different rates for if you're under or over 25 or more employees. So if that's changed throughout the last year, to take a look at those rates and make sure that your payroll is reflecting that. Also, if you have an exemption, a state exemption to a private for your state plan through your life and disability carrier, to request that state exemption, and that's done each year through the state, through Mass Tax Connect, to request the exemption so that you can have that administered through your private life and disability plan. Additionally, a notification of new rates to employees. So while the rates aren't changing, you might have a change to number of employees that requires that update. You still have to notify them each year. So any current employees, you're going to want to post that notice of what the payroll deductions are. And then any new employees that come on board, you want to make sure you're updating that in your onboarding that requires a signature for those deductions. And then, in subsequent years, you can just provide notice if someone has already signed that coming on board. And then also the maximum weekly benefit is set to increase as well. So from that 1,170.64 up to 1,230.39 per week for that weekly benefit. And then some other upcoming paid leaves. So Minnesota, so contributions will begin and benefits at the same time. That's going to be January 1, 2026. Delaware, those contributions began last year, but folks can start taking those benefits starting January 1st, 2026. Maine, same thing, that those contributions began in January, but starting in May 2026, they can start to utilize those benefits. And then Maryland, looking forward a little further, those are going to begin in 2027 with benefits being active in January 2028. We see these new leaves popping up all the time. So I think between now and that 2027 Maryland, we'll see a few more pop up. But just keeping an eye on those different states, if you have folks in these states, to make sure that you're taking out those contributions, you're remitting those to the states, and that you're also making your employees aware if they're in those states that they have those benefits to utilize.
Medicare Part D notices. So you're supposed to let employees know if they're going to be eligible for Medicare prescription coverage, that their medical plan is at least as rich as Medicare when it comes to prescription drug coverage. You need to provide employees with a notice that states whether your plan is or is not Medicare Part D credible. This is due by the 15th of this month, actually, so a week from today, and only technically needs to be provided to Medicare eligible employees and their dependents, so age 65, but also could be younger than that due to a disability. So as a best practice, Innova recommends just providing the notice to everyone, as you may not know the ages of all your employees' dependents. Also, the Medicare Part D disclosure must be provided to the Centers for Medicare and Medicaid Services, that's CMS, within 60 days from the start of your plan year. For calendar year plans, you'll want to update your formal plan documents, your wrap plan, your summary plan description. You'll keep the wrap document for your files. The SPD needs to be distributed to employees. And you have various ERISA notices that you need to be distributed on an annual basis, whether it's the CHIM notice, the Women's Health and Cancer notice, the notice of privacy practices, et cetera. We'll be sending out a checklist of those required notices at the end, but make sure that these are sent out annually and updated accordingly. In terms of how you distribute the SPDs and the ERISA notices, of course, you can do it in person at work, first class mail. You can do it second or third class mail with some caveats. You can provide them electronically. The best way to do that from a compliance perspective is to send the documents to employees' work email, provided they regularly use their work computer. And Tasha, you can go to the next screen. You can post a notice on your company website or HRIS site, provided that you still comply with all the requirements for electronic delivery. So it's not good enough to just post the notices. They need to be delivered. You can move on, Tasha. Thank you.
Yeah. All right. So we'll jump into ACA. And like I said at the beginning, a lot of these slides, these bullets could be full day sessions, but this is just a reminder for, the ACA reporting and review period. So if you are required to submit your ACA reporting, so that means you are an ALE, an applicable large employer who has 50 or more full-time equivalent employees over the previous year. So if we're looking at a 2025 reporting for that 2026 submission date, that means you're going to look back in your measurement year of 2024. So for this reporting, you're looking back in 2024. If you have 50 or more full-time equivalent employees, then you are required to submit these ACA reports. And Innovo can help you determine that if that was a little confusing. But if you are submitting these reports, just a reminder to review this. Who is submitting these? It's typically, tracked in your payroll and your HRIS system, and they're helping to generate these reports, but also to do these spot checks. So looking at maybe a spot check of your part-time, your full-time employees who may have changed status, to make sure that these fields that we see that might be incorrect, lines 14, 15, and 16. So these are codes that are, what medical benefit did you offer the employee? How much did it cost? What did they take the benefit? The affordability calculations, that zip code piece sometimes is incorrect, and just taking a look through to spot check those before you're finalizing those. And then a new piece, you can, so the new piece about distributing and furnishing these to employees, that 1095-C. So previously, you had until that March 2nd, 2026 deadline on or around that March 2nd date to provide these Form 1095-Cs. So last year, the Paperwork Burden Reduction Act was passed, which makes the furnishing of these voluntary. If you have a process in place and you want to continue to just send these out to employees, that is perfectly fine. But if you want to just post a notice, that is allowable. So you are now able to just post a notice saying that these 1095-Cs are available should an employee want to request those. There's no standardized posting form, but there is a recommended template that has been put out. We've included that at the end of the slides, just a template that you can use that has the information needed for employees to request that. It is recommended. They had set the guidelines that you have to post this form somewhere that is clear, accessible, conspicuous, on your website. It could be in an HRIS, it could be where you do your onboarding, some, internal intranet for employees to see. They have it as a deadline from, you have to post it from March 2nd, 2026 to October 15th, 2026. I would suggest posting it before that, considering the deadline to furnish them is March 2nd. Not sure what that the deadlines are about. But you have 30 days to furnish those 1095-Cs to employees once they have requested those. So that is an option for you if you don't want to print and give those and mail them all out to your employees. And then the filing of these forms is still required. So you still have to generate these 1095Cs, your 1094C, to file to the IRS. And that deadline for electronic filing is March 31st, 2026. And again, Innovo can help you manage and work through this process. If you have any questions, please reach out.
Yeah, and for 2026, quickly, just double check in your HRIS system that, that the measurement period, administrative period, and stability period are all where you want them to be. And just, for any existing clients, if you need help drafting an eligibility policy, just check in with your Innovo account manager and when we can help. It's always important to review affordability of your plans, your medical plans. We all need to test for it. Plans get more expensive every year. Maybe salaries aren't keeping up with medical inflation. So we need to make sure that the lowest cost plan, single coverage tier only, is affordable to all employees. For 2025, the affordability percentage is 9.02%. For 2026, it's increasing to almost 10%, to 9.96%. So for 2026, as long as your lowest cost plan, single coverage, does not have employees paying more than 9.96% of their monthly earnings, then your plans will be considered affordable. Here's a sample calculation of an affordability cap for 2026. So in this example, we're assuming that the lowest cost single plan monthly premium is $175. Again, the affordability percent is changing for 2026 to 9.96%. With the employees, the lowest annual salary for a benefits eligible employee is $21,084. So we do the math, right? Take that 21 grand divided by 12, you see the monthly earnings is 1757, and you multiply that by the affordability percentage, and that's how you would calculate what that affordability number is for the lowest cost plan, single coverage only.
Yeah, some other year-end reminders, more things that you have to administer and distribute. So W-2s at the end of the year. So these are due to be postdated by Monday, February 2nd. So before we're getting to the crunch of it all, just confirm who is, going to be managing this. It's typically your payroll company, your HRIS. Check with folks to see if they have any address changes if you are going to be sending these out via US mail, so that you're not receiving, them returned to you. Employees aren't receiving them on time. And then also confirm, what type of distribution, and let your employees know ahead of time. Will they be getting them in the mail? If they can be accessed through, their HRIS, send instructions on how to access those. So, come January, you can reduce the number of emails of where's my W-2? How do I access it? Can I get a password reset? Get a little ahead of that to help yourself out in January. And then also a reminder, if you have 200 or 250 plus employees, you're sending out 250 plus W-2s, you have to include a mandatory insurance disclosure. So that is going to be on that W-2. It's in box 12, and it's just you're reporting the aggregate cost of employee-sponsored group health plans. So your W-2, whoever's preparing your W-2s will, help you do this, administer this, but just a reminder to check that if you are over 250 plus W-2s being sent out. And then some other reminders for notices to be sent and filed. So in Massachusetts, the HERD filing. So this is the Health Insurance Responsibility Disclosure. So this is a reporting requirement in Massachusetts. If you have 6 or more employees in Massachusetts, this is a reporting that's administered by Mass Health, Department of Revenue, and this is done through Mass Tax Connect. So if you're an administrator on that, or you have access to that, you should be receiving that email that you have to complete this filing. It typically opens around November 15th with a deadline around December 15th. And this is just to help Mass Health identify members who may need premium assistance. So this is not reporting on any employee information. This is only on the plans that you provide and the premiums. And again, if you need help, accessing some of this information, Novo is well versed in the herd reporting, so we can help you with that piece. And then also there states the notices of creditable coverage. So in these states, there's going to be forms that will be sent out. So if you're fully insured, carriers will submit those. If you're self-insured, you're responsible for providing these notices of creditable coverage. So in Massachusetts, that looks like that 1099 HC that's provided and sent out around that tax season to prove that you have that creditable coverage in states that require it. And some other year-end reminders. So non-discrimination testing in your FSA, your DCA, as well as your 401k. So for your FSA and DCA, so this testing where you're ensuring equitable eligibility, availability, utilization. This can be done through whoever your third-party administrator is and is recommended to be done each year. So you can reach out to, you can certainly reach out if Novo is your broker. We can help you connect with your TPA to manage that piece. And then for your 401k, also your 401k provider will be helping you manage the testing process for this. So the actual deferral percentage or actual contribution percentage. To ensure that there's no disparity in your 401k amongst highly paid versus non-highly paid employees. If there happens to be a disparity, your 401k provider will help you work through those steps of corrective action on that piece. But something to think about on top of the many other year-end pieces. And again, with your FSA DCA end of the year vacation time policy reminders, just to get ahead of it before you're reaching the holiday season and folks are asking these questions about what can I do with the money in my FSA, my DCA, is the rollover piece, using it or losing it. Same with vacation time, if your policy is a use it or lose it, or what the cap for rolling over is, to remind employees what that is before we get to the time crunch at the end of the year. All right, another poll. So how often are you updating your employee handbook? No wrong answers. All right. Oh, I like that. We have no nevers. Not that it was a wrong answer, but we like to see that. All right, so I'm going to talk about a few policy updates and some reminders that you can take a look at your handbooks and current policies to ensure that you're complying with those pieces. We've talked a lot, and you've probably seen a lot about mass pay transparency. So starting October 29th, this is another piece of this whole Mass Pay Transparency Act. So on that date, employers with 25 or more employees in Massachusetts are required to disclose their wage ranges in your job postings to applicants and current employees upon request. So that's starting at the end of this month. And then some other Rhode Island legal updates. So starting January 1, if you have a new hire in Rhode Island, you're going to be required to provide a new hire notice to that employee. It is going to be separate, recommended that it's separate from the offer letter. So to create a template that's going to include their rate of pay, their exemption status, your paid time off policies, deductions that the employer is going to be making. And this is a notice that has to also be signed by the employee and then kept on file for a minimum of 3 years. So that is a new notice that you'll have to do if you have any new Rhode Island employees. And then another piece, the Rhode Island Fair Employment Practices Act is going to include menopause as a protected condition. So there was already accommodations for pregnancy-related condition, but it also adds menopause and other menopause related conditions to that Employment Practices Act, and that you cannot discriminate on the basis of those conditions. And then also Rhode Island's temporary caregiver insurance. So this is a paid family Rhode Island leave for temporary caregivers. That will increase from 7 weeks to 8 weeks of wage replacement. And then Connecticut, so paid sick leave expansion. So this has been a gradual increase that expands the Connecticut paid leave. And for this year, they're gradually lowering the threshold of employees that a company has to have that you're required to offer that paid sick leave. So in 2026, it's going to be from 25 employees to 11, and then next year you're going to be looking from it's going down from 11 to 1. So essentially, all Connecticut employees will have to offer sick time. And then looking up in New Hampshire, so starting January 1, 2026, employers that have 20 or more employees must allow 25 hours of unpaid leave to folks for childbirth, postpartum, pediatric appointments, and you are required to allow them to substitute their accrued time. And then for Maine, so there is a change to their earned paid leave. They changed their EPL cap up to 80 hours. It was previously 40 hours for rollover. So employees may now carry over up to 40 hours of unused paid leave from the prior year. And then just some more general updates. So looking at the minimum wage increases for the different states, a lot of those become enacted in January 1. So looking if you need to increase any of your employee salaries. We talked about pay transparency in Massachusetts, but there are also multiple states with pay transparency active. There's many pending or new requirements. Innovo keeps up to date on those, and we'll send out notices on those pieces. And then throughout the year, if you've had any company specific changes to policy, maybe there's a slight change to an accrual or, time off benefits, to just, make sure to take a look at your handbook and update those in your handbook. Calling out specifically remote and hybrid work policies. There's a great prevalence in remote work, but also we're seeing a lot of companies moving back to in-office or hybrid schedules. And maybe your policy is not updated to reflect what those practices are. So to take a look and update those pieces. And then this last one here, so the use of chat, GPT, AI in the workplace. We did this version of a presentation of this last year, and I had this as a bullet as well. And it's really amazing from thinking back then to now in just the short year, the rapid evolution of AI in the workplace. It's really embedded in a lot of our tools and practices. I think it's probably embedded in tools we don't even know it's embedded in. So to just take a look at what are some policies and some guardrails we can put around AI in the workplace. I don't think we're going to eliminate it, but putting some parameters around what the usage is, usage in a final work product, disclosure of confidential information, personal health information. If we're using it in recruiting, looking at what is that risk for a possible, inadvertent discrimination. So looking at that, the usage of AI in the workplace, and I was looking a little bit more into some state regulations, and it seems that a lot of states are in the process of passing, usage regulations as well. So keeping an eye on that and the ever evolving use of AI in the workplace. Is updating labor law posters. So those are your federal level and state level posters. A lot of those again come out in the new year. So updating that federal level, a lot of folks are multi-state, have employees across the country. So making sure that those labor law posters are updated and then stored in a place that's shared. If it's a remote workforce, shared drive where employees can access those. If you are have folks that are in office, having those posted in a conspicuous location that folks can take a look at those. Updating, purging personnel records, a nice time of year to, if you have those physical or even electronic records, to take a look, clean those up, using, there's certain deadlines that for, retaining those, but, using kind of that 7-year rule of thumb, to completely purge those records, as well as your annual trainings. So if you have industry specific trainings, there's, a few states that require harassment training or OSHA training, if that's an industry that you're in, to make sure you're getting those trainings out to employees. I'll put a little plug in for, we have a learning management system through Zywave that has a lot of these compliance specific trainings that we can help our clients utilize. If you're a client of ours, it is free of charge, and we can help to initiate some of these trainings. Other year-end reminders, you might have a end of year review cycle. So another, just getting ahead of it, creating that timeline now, looking at what your merit pool is, or is it a cost of living increase? How are those decisions going to be made? And what are those goals looking forward for 2026? And then just some reminders, moving into 2026, after we get through the rush of year end, the EEO reporting, if you're over 100 employees, that reporting period is between April and June. So if you are required to report on that, to take a look at your HRIS system where you can capture that information and pull those reports from, and get that set up to help it make it a smoother process when you have to do that reporting. And then if you're required by OSHA to submit those compliance forms, those are in the March timeframe. If you're 10 or more employees and you're not exempt, submitting that form 300 and 301, as well as posting that form 300A, which is a log of all incidents that have taken place. So that has to be posted in your workplace, or where people can access it, from February 1st to April 30th. All right. And all we have there, some questions. I think we have a couple questions. If we are a mass employer hiring an individual who lives in Rhode Island, is this required? This is related to the new hire notice in Rhode Island. If the new hire is living and working in Rhode Island, yes, the new hire notice is required. If they are working, if they live in Rhode Island but are reporting to Massachusetts, their workplace, they're paying taxes to Massachusetts, and they're a Massachusetts employee, then no. But if they live and work in Rhode Island, then they're a Rhode Island employee, and that new hire notice would be required. All right. You have any other questions?
Yes, another question with respect to FSA and HSA. So someone currently has an FSA and they're thinking about enrolling in an HSA plan for 1/1. What are the rules that are surrounding that? Well, you can, obviously, you can switch between the plans. You can make the switch to the HSA compatible plan, but you need to draw down your FSA balance to 0 prior to 1/1. The one caveat being that if you have an FSA and your employer has an LP FSA, that's a limited purpose FSA, that is attached to the HSA plan, you can roll over your FSA funds to the LP FSA funds, but only use it for dental and vision expenses, and up to that $660 rollover. Another question coming in regarding an ICRA. So the question is that they need, obviously, we walk through the annual benefits notices that need to be provided every year. And as part of those benefits notices, there is a Medicare Part D disclosure notice. So so this question is, again, the employer has an ICRA, and what Medicare Part D notice do they send out? The creditable coverage notice or the non-creditable coverage notice? Yeah, this has been discussed a lot internally at Innovo. The answer is everyone should be getting a non-creditable notice because the ICRA itself is non-creditable. The individual policy purchased by an employee may be creditable, but the actual ICRA is not. And the notice is really specific to the ICRA, not the individual policy that an individual has chosen. So Innovo, we recommend adding in some additional verbiage to that non-creditable notice. Something to the effect of, it's possible that your own individual plan is Medicare Part D coverage, but please check with your own individual insurance carrier to see if it is in fact creditable or not.
If anyone thinks of any questions after, you can reach out to any one of us at Innovo and we can help you to answer those. And then also, so all of our webinars, this is new. We have a new library of all of our webinars posted under Innovo Insights. So please check it out and you can view all of the webinars that we've had over the years. And then also our next webinar is a XyWave walkthrough. So I had talked about that, about our XyWave learning management system, but there's a lot of other pieces to XyWave. So if you're interested in that, that will be coming up at the end of this month.